Hi, I'm Dr. Manasa, consultant endocrinologist at Rachana Hospital, RR Nagar, Bangalore.
Hello, I'm Dr. Rachana. I'm working as a consultant endocrinologist at DHEE Hospitals, Bangalore.
Hi, Rachana. So today, tell me about what is polycystic ovarian syndrome.
Okay, so let's talk about most common thing what we hear in the office is what is PCOS. It's a metabolic condition in which the baseline is the pathophysiology is insulin resistance. So because of insulin resistance, the ovaries they tend to make a lot of excess of male hormones, that is androgens. So they can cause a lot of symptoms like irregular cycles, acne, hirsutism, and a lot of weight gain and other metabolic complications.
So it's like a metabolic problem causing a reproductive issues.
Yes, absolutely right, ma'am.
Okay.
So in your clinic, what are the most common things do patients come with you for, ma'am?
Yeah. So the most commonest symptom is the irregular cycles. So like they can have cycles once in 2 months or once in 3 months. Or generally the definition of oligomenorrhea is if they have less than 8 cycles per year, or if the cycles are prolonging for more than 45 days. So these are prolonging for more than 35 days. And these are the symptoms that they come with. The other symptoms are excessive hair growth on the face and loss of frontal hair. And then sometimes they can come with ultrasound reports saying that there is polycystic ovarian morphology. So there are multiple cysts in their ovaries with a little stromal hypertrophy that can be seen. So the commonest symptom, if you ask me, it's irregular cycles. Yeah. The other symptoms are excess hair growth and ultrasound features suggestive of polycystic ovarian morphology.
Okay, yeah.
So the next question I would like to ask is, what are the investigations that you would like to do? How do you evaluate?
Okay. So more than evaluation, us evaluating, the patients come to us saying that, Madam, I have a report of an ultrasound. So it says polycystic ovarian morphology. So does that mean I have PCOS? So that's one partially which is right and partially which is not correct. That means all ultrasound reports which say PCOS does not necessarily mean that you have PCOS. It's always diagnosed by a combination of symptoms. Like you said, irregular cycles should be there, or plus or minus acne or hirsutism. These are signs of hyperandrogenism. That is, your body is making excess androgen hormones. So only a diagnosis of PCOS on ultrasound does not necessarily mean you have PCOS. So it's always a combination of symptoms, ma'am. And ma'am, I always keep hearing that PCOS occurs only in diabetic people or only in obese people or overweight people. Is that true, or can a person with BMI of just 19 or 18 also get PCOS?
Correct, Dr. Rachana. Like it's people have that myth saying that it's only of obese people. So it's actually wrong. Actually, we have something called as lean PCOS also, where BMI is well within the range, but still they can land up having polycystic ovarian syndrome. So if you ask me, only obese can get PCOS, actually it's a myth. Anybody with any BMI can get PCOS.
Okay. Thank you for clarifying that really important myth. Yeah.
So what are the complications of PCOS?
Like you said, ma'am, it's a metabolic condition. So people at PCOS, they commonly ask us, do I have risk of getting diabetes or pre-diabetes or hypertension or dyslipidemia or metabolic syndrome? Yes, it is very true and it is very possible. But PCOS mainly being a lifestyle disease. So when you treat the lifestyle, most of these metabolic parameters tend to come back to normal.
That's correct. So it's predominantly a lifestyle issue,
yes,
which has to be treated with lifestyle management mainly. Only.
Yes. Another thing most commonly is like when should I be really alarmed? Like I have PCOS, I have irregular cycles, but I'm not really running to the doctor. When should I really go and immediately consult a doctor?
Okay. So the important points where you have to consult doctors is, one is very irregular cycles. Like if they don't have cycles of more than 8, at least 8 cycles is a minimum that has to happen per year. If that doesn't happen, if cycles are getting prolonged more than 35 days, and lot of hirsutism, and these are and if they're planning for pregnancy, and if they have a lot of metabolic features like abdominal obesity and the OSA symptoms. These are the things where you have to consult doctors.
So PCOS is always like a diagnosis of exclusion. Like how we say.
Yes. So how do you treat?
Okay, the baseline, like how we said, the mainstay is lifestyle, that is the diet and the exercise, especially with the diet, how we focus on low calorie diet, be in any form, low fat or low carbohydrate, it should be low calorie, and especially a lot of your plate should contain a lot of vegetables in the form of any form of fiber should be there, and a good amount of protein also should be there in the diet, especially with exercise, at least 30 to 40 minutes of aerobic exercise we do say, interspersed with maybe 2 to 3 days a week at least of some strength training also should be there. Apart from that, for some people who want to conceive, there are medications which can help them to conceive and to improve the fertility rate, and there are tablets like if you are on the borderline for diabetes or if you are overweight or obesity, metformin is a good drug which can help you reduce the insulin resistance. And sometimes for regularization of cycles, we do give oral contraceptive pills also for a short period of time. Any other things, ma'am, which the patient should really take care, like for the future, that I don't get diabetes, or any other risk factors the patient has to watch out for?
So, like you told, the basis of PCOS is insulin resistance. So, insulin resistance can lead to metabolic syndrome. So, anybody who has PCOS during their reproductive years or during the adolescent years, no, it's a sign that you are at high risk of developing metabolic complications, like it can be diabetes, it can be hypertension, dyslipidemia, and even if they're planning pregnancy, they're at high risk of developing gestational diabetes. So, all these things. So, therefore, the major foundation for the treatment is always lifestyle modification. So as soon as somebody realizes they have polycystic ovarian syndrome, it's right time to start their lifestyle modification.
Yeah, exactly. So with the right treatment and the right exercise, PCOS is not a very completely curable disease, but it's a very manageable and preventable disease if you take the correct lifestyle measures, right? Yeah. Thank you so much.
Thank you.
Yeah.
Thank you.
Thank you.
Thank you.